Hi, my name is George. I'm going to perform a comprehensive video assessment for our advanced health assessment class. This is Christina. She's going to be my volunteer. Christina, do you give me consent to perform this assessment today?
Yes.
Okay, thank you. So we're gonna start by generally inspecting the skin. So we don't see any, I don't see any deformities, any skin issues, no rashes, no edema, um, no lesions. The temperature of the skin is warm and it's dry, no moisture. So now I'm going to assess the head and the scalp. So I'm going to palpate, inspect and palpate the scalp. Um, Again, we're checking for any deformities. We're checking for symmetry, for an equal distribution of hair, and I don't see a pattern of hair loss. After assessing the scalp, I'm going to move down to the head and the facial area. So now, again, we're checking for symmetry, edema, lesions, lumps, depressions, and I don't see any of that. So now I'm going to assess two of the cranial nerves that are associated with the facial movements. No involuntary movements I see. I want you, if Christina, if you can smile for me, frown, or if you can close your eyes tightly. Thank you. Now I'm going to assess, that was a facial nerve. Now I'm going to assess your trigeminal. So I'm going to basically palpate her masseter. Can you bite down for me? Clench your teeth. Thank you. Now her temporal muscles. And now if you can, I'm going to put some resistance. I want you to move down with your, perfect. Thank you. So after assessing her head and face, I'm going to assess her ears, her eyes, sorry. First the eyes. So I'm inspecting for any discharge, swelling around the eyelids, around inside the eye. The color is normal, white around the eyeball. And I don't see any erythema either around the eyes. So we're going to assess some cranial nerves that are associated with eye movement and vision. First, I'm going to use the Snellen chart to check for visual acuity. So I'm going to have Christina cover one of her eyes. Can you cover your first eye, your left eye? So I'm gonna have her read the smallest line possible.
EXRZ.
Okay, can you cover the other eye now? And read the same.
EXRZ.
How about you read the second line?
ABOT.
And if you can read the first one with the other eye covered.
AEDX.
Okay, thank you. So after assessing her optic nerve, I'm going to be performing a few other eye movement tests and vision. So I'm gonna have you stand up, please, and face me. So I'm going to test for confrontation and accommodation. So I want you to follow the object. I'm gonna move it around in the 6 different fields of cardinal gaze. So I'm gonna start here, and do not move your face, just your eyes. Okay, perfect. Now I'm gonna be performing another test. I want you to follow the same object with your eyes. Thank you. So now I'm going to flash the light into your pupil. I'm going to be checking for nystagmus or any lid lags, okay? I'm gonna flash it, okay? first with the left eye. Thank you. Perfect. No involuntary movement, no nystagmus. After assessing the eyes, I'm going to move to the ears. So I'm going to inspect first externally, assessing the external part of the ear, the tragus, behind the mastoid bone, the auricles. No tenderness, no erythema, no swelling, no discharge from the outer part at least. So now we're going to assess it internally. So I'm just going to pull back a little bit. Okay, so now we're checking for we check the tympanic membrane. It's intact. There's no cerumen, no discharge, no redness, no swelling. So I'm going to do the same thing for the other ear. So I'm going to go to the other side. Pull up a little bit. Thank you, perfect. So now I'm going to assess the cranial nerve that is associated with hearing, the vestibulocochlear, which is the number 8 cranial nerve. So what I want you to do, Christina, is to cover your left ear first. I'm going to whisper two words, okay? Apple pie.
Apple pie.
Okay. Now I'm just gonna move to the other side. I want you to cover your right ear.
Mm-hmm.
I'm gonna say 2 words, okay? Big shoes.
Big shoes.
Okay, perfect. So after we assessing the ears, we're gonna move to, we assess the eyes, we assess the ears, now we're going to the nose. So again, we inspect first on the externally, no deformities, no erythema, no redness, no erythema, no swelling. I'm going to palpate the nares to see for any nasal obstruction. Any pain when I touch?
No.
No. Now I'm going to use again the otoscope to check internally for any polyps, any obstructions, epistaxis, or any other foreign objects. So there is some slight septum deviation, no perforation, but there is some deviation. So now I'm going to palpate your frontal and your maxillary sinuses. And we check here for tenderness. Any pain when I do that?
No.
Okay, perfect. So we assessed the nose, the ears, the eyes, the face, and the scalp. And now we're going to move down to the mouth and the jaw. So again, we check for the lips, for the color, which is nice and red, no cyanosis. If you can open your mouth for me.
Mm-hmm.
And I'm going to use the flashlight to see. So the tongue is red and moist, which is completely normal. Can you show me your teeth? The teeth are intact. Gums are not bleeding, they're intact as well, red and moist. If you can open your mouth for me again, please. Now we're checking, as we said, for gums, teeth, tongue, no ulcers, and the tonsils are in place, no inflammation. Anterior and posterior pillars are intact as well and not inflamed. Perfect. Now the associated cranial nerve that we're going to check here is the glossopharyngeal and the hypoglossal. First, if you can look towards me, I want you to stick your tongue out. Sorry about that. I want you to stick your tongue out, please. And if you can move it side to side. Perfect. Now I'm going to use a tongue depressor, and I'm going to see if you to check for your gag reflex. I know it's going to be a little bit uncomfortable. I'm not going to do the whole thing. Okay. So. Okay. Perfect. So there is gag reflex. We assessed the mouth and the jaw. Actually, last thing that we have to assess is the, I think we already did the masseter and the temporal muscle, and we put resistance under the chin. Now we're moving to the neck. The neck, again, we start with inspection. We're checking for deformities. No deformities here. No trach deviation. The thyroid gland is firm. No issues. Can you swallow for me?
Yep.
Perfect. No pain with swallowing, right?
Right.
Okay. Neck. Assessing the neck after inspecting it. I'm going to check for the jugular venous pressures and pulsations. No pulsations here or here. Perfect. I'm going to check her carotid pulse. Perfect. Perfect, present. Okay, I'm going to auscultate it later. So with the neck, I'm going to assess your lymph nodes. I'm going to start from around the ear area. So this is the preauricle, post-auricles, occipital in the back of the head, and we're moving to the jawline. So it's the submandibular, the tonsillar, submandibular, and the mental at the angle. The angle, at the chin is the submental. And now we're moving down to the neck. We're following basically the sternocleistomastoid and the trapezius. We're checking for the lymph nodes, palpating them in the anterior cervical. Then we're moving down to the posterior cervical along the trapezius. Then the deep cervical chain and the supraclavicular, which is at the deep end of the sternocleistomastoid. So after finishing with the neck assessment, we're moving down to the thorax and the lungs, the lung assessment. So now you can sit back, if you can sit down if you want. So now we're checking for any breathing abnormalities and breathing physical abnormalities. So any breathing issues right now?
No.
No, okay. So we're checking for chest asymmetry, thorax asymmetry with breathing, any muscle, accessory muscle use with inspiration and expiration. So now I'm going to auscultate your chest, and I'm going to check for tactile fremitus, any and other abnormalities. You can sit back, you can sit down. I want you to take a deep breath for me. Perfect. Now I'm going to auscultate her carotid pulse that I palpated earlier. Right here. If you can turn to the other way, and your jugular venous pressure. Perfect. We're checking for bruit. Now I'm going to check for any tactile ephemeris, so I'm going to percuss as well. You don't have to. Sorry. Perfect. So after assessing her lungs and listening to her lung sounds, I'm going to listen to her so yes, we assessed the lungs. We're moving down to, we're listening to any venous humps, the abdominal aorta. We can palpate as well. We can move down to the abdomen. Okay. So I'm going to assess, to listen to her aorta. Okay. Perfect. So let's go back to the thorax. I'm going to listen to your pulmonic tricuspid, mitral, and Erb's point first. Down to the Erb's point, which is at the third intercostal, mitral. Perfect. Okay, so after assessing these points of the thorax, we're moving to the abdomen. So with the abdomen, again, so now I want you to lay down if you could.
Okay.
I'm going to have you place something for your head support, knees bent, and arms on the side. So now I'm just going to uncover your abdomen only, okay? So now we're checking again for any tenderness, any masses, pulsations, any striae, or any lesions, anything abnormal in the abdominal area before we palpate, auscultate, and percuss. After inspecting, I'm going to auscultate your bowel sounds in all 4 quadrants. So present normal active bowel sounds in all quadrants. Now I'm going to auscultate your arteries. So I'm going to start with the aorta, renal, iliac, and femoral arteries. Aorta, renal, iliac, and the femoral on the upper thigh. Perfect. We can also palpate those. And we also palpate the inguinal lymph nodes here on the closer to the groin area. So after assessing her bowel sounds and listening to the aorta, we can check for a venous hump, which is right here in the middle of the abdomen. On the right upper quadrant, we can check the width of the liver, and we can palpate that. Any pain here?
No.
No. And then the spleen, we're checking the friction rub here of the spleen. Any pain? And usually the liver width is between 6 to 12 centimeters. So after doing the abdominal assessment, we're going to perform muscle strength testing and reflexes as well.
Make sure it's still recording.
Yes.
It's still
Just
recording.
want to make sure that it's still recording. Perfect. Yes. So if you can sit for me, just sit. Yep. So I'm going to start with a coordination test first.
Do you want to close the door?
Yes.
Yeah.
So coordination test. If you can stand up for me, and if you can walk towards me and walk back, and if you can hop. Okay, perfect. Now I'm going to have you be performing two tests. If you can face that way, I want you to stand with your feet close together. No arm support. Close your eyes for 30 to 60 seconds. We're not going to do that for a whole minute for time purposes. If there was any imbalance issue, you wouldn't be able to stand with your eyes closed. Now I want you to stay like you are. You can open your eyes, but I want you to have your palms up. And again, you would stay there for 30 to 60 seconds. We're checking for a pronator drift here. If there was any imbalance issues, you would be your arms would be shaking or changing positions. So after that assessment, we're going to test flexion, extension. We're going to assess your upper extremities. Again, we're checking for, we're inspecting first for muscle symmetry, contour. I'm checking the nails, no cyanosis, capillary refill is less than 2 to 3 seconds, no clubbing. Can you see the other one? Perfect, no clubbing, no cyanosis, which means good oxygenation and perfusion. So now I want you to, where are we going to start? We are going to start by flexing your elbows and point towards you. Perfect. Now I want you to, I'm going to put put resistance. I'm going to put resistance against you. Okay. Now I want you to extend them. Extend them. Now I want you to grab the third and second finger of mine. I'm going to pull towards me, but you resist. Perfect. So now I'm going to, after assessing flexion and extension, grip strength, we're going to move to the wrists. I want you to extend your wrists. So extend your wrist, and I want you to push down. Perfect. Okay. So we're staying in the upper extremities. I'm going to assess your reflexes with the bicep and triceps reflex. Bicep.
Stand back here.
Yes. Sorry. So bicep. I want you to flex your bicep. Okay. So now extended. So I'm going to strike where my thumb is, and you're gonna see that this is going to move a little bit, okay? Okay. Now for your tricep, I'm going to do the same thing. I'm going to be supporting your arm, and I'm going to strike again against where I'm supporting your arm, and my thumb is right here. So just above the elbow is your tricep. I'm going to strike there. Okay. Perfect. Now I'm going to strike. I'm going to test your bradiocephalic nerve reflex against your radius. So here. Okay, perfect. So after that, after assessing those reflexes, we stopped at the upper extremities. So we tested the grip strength, flexion and extension of your wrist and elbows. We're gonna check your scapula, so your shoulders. We're gonna check one of the cranial nerves that we didn't check earlier. So that's the accessory cranial nerve. So I want you to press against my, shrug your shoulders basically. Okay, now move your chin to the chest, move your chin to the ceiling, and move your head over your shoulders. So check over your shoulders. Perfect. So we're checking again for any abnormalities in the scapula. No deformities, and no pain when I touch here, right? Okay, perfect. So after we assess the upper extremities, we're gonna move down to the lower extremities and the spine. So you can sit down if you want. So we're checking for any curvatures. Posture is normal. Any pain when I touch here?
No.
And also I forgot to assess. Now we're checking the spine and the lower back, the mid back. I wanted to test for CVA tenderness. Do you have any pain when I touch here?
No.
This could be a sign for kidney issue. So I forgot to include that earlier. So after assessing the spine, we're going to move down to the lower extremities. So we're checking again. We're going to start with the hips. So now I want you I'm going to check for flexion of the hip. So I want you to flex your hip. Okay, now the other one. And now extend it. I'm going to place my arm here on the shin. Okay, now the other one. Okay, perfect. Now I want you to, I'm going to place my hands on the top of your thighs here, and I want you to, I want you not to let me pull your feet apart. Okay. Now the other way is to try to move your feet to inward. So connect your feet basically, your legs. Okay, perfect. Now we're going to assess the knees. So I want you to flex your knees. I'm going to place my hand on the shin. Extend it for me. Perfect. Now the other one. I'm putting resistance here. Now the other for flexion is the opposite. So try to flex it. Thank you. The other one. Perfect. Now for I'm going to test for plantar flexion and dorsiflexion. So first I'm going to place my hands under her feet, and I want you to make the motion that you do when you press on the gas pedal. Perfect. Now I want you to do the opposite thing. I'm going to put my hands on top. So your plantar flexion to test for the Achilles too. Okay. So after assessing the flexion and extension of your knees and your ankle and your hips, we assessed the lower extremities. Now, I forgot to include the inspection first. So first, before we do all that, I wanted to check if you have any edema, peripheral edema.